Recording in progress.
Welcome to today's special event at eLotus. With over 200 years of hosting educational courses, eLotus is your trusted source for premium CU content, offering 900 courses, 250 speakers, and 3,500 hours of continuing education. My name is Donna Chow, your host and your moderator for today's class. Thank you for joining us. Today's webinar will be held from 2 to 4 p.m. Pacific time. And before we begin, please set your chat preference to everyone. This is important for an interactive session. Questions may be asked using the Q&A box, and that will go directly to Dr. Chang. And after the webinar, a quiz will be available and an email will be sent to you when it's ready. We are excited to present today's webinar, Peripheral Neuropathy, Arthritis, Joint Pain, Hepatitis, Fatty Liver, Dr. Jimmy Chang's Herbal Master Sheet. Dr. Chang is a renowned expert in herbs and pulse diagnosis with over 40 years of clinical experience and having treated more than 500,000 patients. He has been exclusively supplied by Evergreen Herbs for an impressive 25 years, making them the perfect partner for his clinical practice and research. We are honored to have Evergreen Herbs as our sponsor for this webinar, given their commitment to quality and service. During the webinar, Dr. Chang will share his extensive knowledge in pulse diagnosis and herbal prescription, with a particular focus on his unique herbal combinations. You will gain valuable insights into pulse indications for specific conditions and learn how to prescribe herbal formulas effectively. Dr. Chang has previously conducted several courses for us, which are now available as distant learning CEU videos. For those interested in enhancing their pulse diagnosis and herbal skills, Dr. Chang is the go-to expert. We highly recommend the Gold Pass membership, offering unlimited access to his foundational pulse courses and herbs prior to 2020. And as a special offer, the Gold Pass includes an herb voucher provided by our sponsor, Evergreen Herbs, allowing you to experience the mentioned herbs firsthand. This incredible value is perfect for those serious about mastering herbs. For more information, feel free to check the chat room, where we'll provide additional details. All right, so let's go ahead and begin today's class with a brief overview of Dr. Chang's herbal approach, ensuring everyone stays on track. If you're a longtime student, feel free to review or take a 5-minute break. Dr. Chang's herbal style differs from traditional methods taught in schools. He exclusively uses extract powders from evergreen herbs, offering around 300 single herbs and 100 formulas. In his pharmacy, Dr. Chang has approximately 150 single herbs and formulas combined. And you can find more information about his pharmacy in the YouTube video linked in your lecture notes. For those interested in starting a pharmacy like Dr. Chang, Evergreen Herbs is currently offering a 15% webinar discount on the essentials of Dr. Chang's pharmacy. You can find the link in the chat room or refer to your lecture notes for details. Formula evolution is a key aspect of Dr. Chang's practice. He creates his own formulations, giving them names based on their purpose. These formulas may change over time as he sees more patients and makes modifications. Updated formulas are denoted with a 2.0 to indicate a new version. Fang, which stands for formula plus formula, involves combining different formulas to achieve enhanced effects. Evergreen's extract formulas are decocted and extracted together rather than just combining individual herbs. For a more detailed explanation on Fang, Dr. John Chang has a video explaining the concept in more detail. Dr. Chang's herbal prescription is typically comes in 100-gram bottles, though for non-local or chronic conditions, 150-gram bottles are prescribed, which also offer the patients a discount. The recommended dosage for a 100-gram bottle is 3 spoons, 2 to 3 times a day. When reading Dr. Chang's prescription, if he lists herbs followed by a number, it means that all the herbs before that number are in that percentage. For example, in Sleep Combo 2.0, 酸枣仁汤 is at 40, while Yi Jiao Teng, He Huan Pi, and Zi Tong Yan are at 20. Can you tell me how many grams he would use if for He Huan Pi? If the total amount is 100 grams, how many grams would He Huan Pi be? Go ahead and type it into the chat room. All right, so did anyone answer 20 grams? Because if you did, you got it right. Congratulations. All right, so regarding mixing herbs yourself, it is definitely an option and you're more than welcome to. Some herbs such as circulation, sanjiao, and astringent are already pre-mixed as collection formulas in Evergreen's proprietary line. However, many new formulas are not pre-mixed yet, as Dr. Chang is still customizing them. So feel free to mix your own concoctions or use Dr. Chang's formulas as a base to create your very own. All right, so that concludes my short introduction. Let's go ahead and welcome Dr. Chang to take over the class. Dr. Chang, go ahead and share your presentation now.
Can you hear me now? What? Okay, we begin. Hi guys, this is Jimmy Chang again. Today I'm very happy. Today is August 16, 2023. I'm very happy to be here to discuss or share with you some of my experience using Chinese herbs for treating the peripheral neuropathy, arthritis, hepatitis, and everything. Yeah, arthritis is more common. You can see it every day in your daily practice. And that's what I'm seeing right every day here. Lots of people asking for a treatment of the pain. So let's begin. Okay, that's my, do I have to mix herbs myself? Yeah, some of them is, I have my own combination and some of them pre-mixed by Tina. So you simply order it, that is okay. And what does it mean, Fang Jia Fang, that beautiful lady just told you? Fang Jia Fang means formula plus formula. I just put them all together, like I'm cooking or something, put salt, sweets, sugar, vinegar into one pot and mix it just like that. It's no big deal. Okay, usually in my office, my procedure is I look at the palm. I look at the palm first and look at this wrist area, and somehow we can find a lot of information there already. And then I ask him to put a hand on my pillow, and I start taking the pulse. But I know some of you do not do this. Yeah, some people always have to ask, oh, what can I do for today? What seems to be the problem? I do not ask them. I do my procedure, and of course, the most important is the ear signs. After reading all that information, I just ask them, what do you want me to do for today? That's all I ask. And but not everybody wanted it or could do that. So let's pretend. Let's say that there's a male guy. I'm sorry. Complaining about the back pain. You're lucky. You have already have the question. All you have to do to find the answer why this guy is suffering from the back pain. Could it be the old injury or the new injury or the new car accident or disc pressure like a bone spur, or simply the pain was caused by a kidney stone, or if it's a lady, it could be the result of a prolapse uterus or cyst, or something swollen in the abdomen area like fibroid, something which already almost every time it will cause the back pain. So now is the our job to find out the reason for his back pain. But anyway, you're lucky. He already told you what he wanted. What would you do? Do that. And for example, this area, this is the hip. So you see the hip area? It's dark. It's dark. And so I always use the 生痛足浴汤 to take care of it. See the darkness there? And this grooves means sleeping disorder. And this is the head. And this is the gallbladder. This is the skin allergy. And this is abdomen. Some dead blood. Even if it's a male, there's some blood stagnation in the abdomen area. And this definitely the back pain. So by looking at this color, then you know the nature of this back pain is blood stagnation. So usually I will use this 生痛足浴汤. 生 means body, 痛 means pain, 足 means expel, 浴 means stagnation, dead blood. So this is just an example. We've got a lot to come. Everything is based on my 45 years experience. Okay, you can see this too. This is the hip. So the hip is red. So the inflammation is definitely there. This is the sciatica. And this, see the string of bees? That's uric acid. This guy must have some gout. And this area, if it's a lady, this area is the breast. The breast, you have to check the both ear. If one ear in this section is red, the other section is red, and then the other part is dark brown. So one black, one dark brown, one red. On the breast area, that could mean breast cancer. Be careful. I always warn the lady, you have better do it better. A mammogram. Oh, so I already did a mammogram. It's okay. Next time, try the ultrasound. I saved at least 6 ladies' life by saying that. And this is the hip. Also the inflammation there, abdominal area. Oh, this is neck and shoulder. See, it's all red. So it's the inflammation. The treatment strategy might be a little bit different. And see, this is the inner ear of this area. With the inflammation, this guy or this lady definitely will have some vertigo, dizziness. So let's start with the peripheral neuropathy. The 周遭神经病变. Today we are bilingual. By the request of some of our members want me to say something in Chinese. Okay. Feeling the numbness, tingling or prickling sensation in the feet or hand that may spread over the leg and arms. So all the small ants, I always say small ants. Actually, by looking at the palm, you can tell a little bit about the small ants. If the tip of the finger are red, you can tell the peripheral area is inflammation. If the fingertip is too small, then you can tell his peripheral circulus is terrible. Or this area is dark and brownish, that means, especially you can look at the fingernails. Somebody has dark brown lines on the fingernails, straight lines, dark. Then you can tell definitely without even having to take the pulse, then you know that his peripheral area is stuck, blockage. Then you want to touch this guy's hand, no matter he's big or strong, or the lady. If it's freezing cold, then you have a general idea something gotta be the peripheral stuff 啊。这个脚或手会感到麻木、刺痛，然后到这个肩膀的痛或者烧灼痛。你看这个指甲如果黑黑的，就是淤血；指甲手指头肿肿的，就是发炎啊。So I usually this formula is my favorite, 生痛足浴汤. So this is for blood stagnation, for blood stagnation, and this pair is totally essential. You must have it. If you don't have it, you order 10 bottles or 20 bottles from Tina now. And this one, the proportion is 50% and 25%, 25% to make 100%. I do 150 grams for the patient, so You can adjust the this like 75 cents or something. And how do we take the herbs? I never realized that a lot of acupuncturists didn't know how to address the patients to take the herbs and the dosage. For a grown man, I would do 3 times 8. I mean, 3 times 8 grams each time. Sorry. And by warm water after meal or before meal, doesn't matter. If it's too little and there's no effect. So this is what I do for general people. So the 生痛足浴汤, I order a lot from Tina. It's very good for all kind of a joint pain, circulation. Even you are not so sure about the diagnosis, you just simply use it along with this. And for another great tip, if the pulse or the signs of the fingernail or fingertips and ear signs, we'll talk about ear sign later. If it's all red, inflammation, you can simply replace this one with my astringent complex. Astringent is so good for inflammation, and put them all together, you can get a good result in less than a week. Okay?
Dr. Chang, can you hear me?
Tina, I cannot hear her.
Oh, you cannot hear me?
Hold on, I cannot hear you. Quiet.
Sam is gonna turn on the microphone for you. Can everybody hear me?
Tina?
Can you type yes in the chat room? If you can hear me? Great. I'm gonna help with moderating and ask questions so you guys can better learn the formulas. Okay, Dr. Chang does buy a lot of 生痛足浴汤 from us.
Yeah.
So
I'm using this.
So Dr. Chang.
It's working. Is it working? But I cannot hear Tina.
So when would you use 生痛足浴汤 versus 舒筋活血汤?
How about now?
舒筋活血汤.
Oh, Tina, I cannot hear you.
Okay. How about now? Can you hear me now?
No, it's just his headphone that he's using. Hold on.
Yes, X50. Yes.
Technology with the earbud. Those earbuds give me a headache. I don't know why. Maybe.
Hello. Just
Hello.
No, I cannot hear.
See that this one not working.
What do you mean it's working?
Right now testing, it's not working.
This is your earring, Dr. Chang.
No, I know, but the mic working, but no headphone not working.
It's Tina's problem.
No. We can't hear her.
Okay, I'll try this.
Okay, anyway, I'll type it down. When, you know, Dr. Chang has all these really good formula he uses a lot in his clinic. So to better understand why he uses certain, why he picks certain formulas, that will give you a guideline to distinguish the subtle difference.
I can hear it, Tina, but it's very blurry.
Okay. So we can learn the subtle differences between the formulas.
Okay, I can hear.
So this way, when we're looking at our pharmacy, we would know.
Make it louder.
When we write out a certain formula, for example, what can be used as a substitute better. So, all right, we have some advanced students here. So can you hear me, Dr. Chang?
Yeah, I can hear you now.
Okay, great. Can you tell us why you pick 生痛足浴汤 and not 舒筋活血汤?
I don't know. I like this one better.
Sometimes, okay, this is honest answer from a advanced practitioner. Because,
45 years of experience.
Right. Sometimes it's because of this. I'll tell you honestly. When two formulas are very similar in function, it's the reason why they pick the certain formula is because of the price. It is a cheaper price. That's a possibility. Right, Dr. Chang? When we can use a formula that is
with the money.
No, I mean, if we can achieve the same purpose at a lesser cost, why not? You know, you can pass on the saving to the patient too if you like.
Yeah,
So
that's
okay,
good.
生痛足浴汤、素经活血汤 is about the same.
Yeah.
Okay, great. And how about for those people who haven't heard this word new, when would you use 四逆汤 versus 生痛足浴汤?
No. It's not the replacement. 四逆汤 is for circulation, to push the circulation to the extremities, to the peripheral nerve system, because some people are weak, anemic, and cold on their hand and feet, especially those ladies. They have no circulation at all. They're so picky about their food. There's no exercise. Their blood pressure was very, very low. So that's the time I would add like 20% of 四逆汤 to push the medicine through the extremities.
Okay, you guys got that? So, you know, 生痛足浴汤 for regular patients. If you show weakness and cold, use 四逆汤 a bit.
Okay. So, like I said, I replaced this one. I replaced 生痛足浴汤 with astringent for the inflammation case. Okay. And the pain.
Sorry.
Huh?
When you're talking about inflammation, you're seeing that you said in Chinese earlier that the extremities are swollen and red, or just swollen?
Not necessarily swollen, but red.
Okay.
Okay, the next case. Pain during activities and that would not cause pain, should not cause, such as weight bearing on the food or feeding food pain, with the mostly is the water retention. That the major factor here for making decisions what formula to use is the water retention. Okay, how do you know there's a water retention? I can clearly see it from the from here. This is very difficult to describe it, but I can see it. When I see a patient's wrist, I can see the water under the skin. I don't know how to describe it, but anyway, all you have to do is press it down. If you press this area, it turns and release it, it turns white and it won't come back fast enough, then you can tell there's water under the skin and in the tissues. Then you can go ahead, press his leg on the 三阴交叫什么？
三焦, I mean, not 三焦, spleen 6.
Spleen 6 area. Press down, you will see a big hole there. Then you can definitely tell there's edema or water retention in the human body. And you can also demonstrate to your patient that you're right. Some people say, no, I don't have water retention. Okay, let me show you. Then you can definitely show it. So the left chi and right yang wei pulse and the phosphor. Left chi, actually, this is not right. This is supposed to be left too. The chi is deep and forceful. That means inflammation in the lower part. And yang wei is here. If it's forceful and deep, that means inflammation in the lower part too. So we take both pulses to verify the condition, damp heat, and inflammation. So the pain 不正常的活动引起疼痛，脚步站久了，重点是在下肢水肿。左手跟右手阳维脉沉而有力，右手也可以的，阳维脉两手都一样，阳维。Both hands are clear. But 左齿 is 代表 the lower part, left chi. The left chi is the lower part. So with a case of a water retention, I always would like to use this one. 当归碾痛汤. 当归 is a circulation pushing single herbs, very famous. Nian means get rid of the pain, and also definitely 乳香没药. So first, you must decide if there's a water retention in the lower leg or not. If it is sitting there, then you can choose 当归连痛汤. You can get rid of the water retention, and you should take a look at the patient's small legs and ankle area. Sometimes you can see it, then you don't have to take the pulse just by looking at it. Some people with the swollen ankles and ankle and feet and the little ankle there is all swollen. Sometimes the color is white, some color is red, some color is dark. I was seeing a guy, big guy with a leather jacket. He's a biker, and I take the pulse and oh my God, so you have a lot of inflammation and blood stagnation in the lower limbs. Then he showed me his leg. It was terrible with the open wounds and the blood stagnation, dark skin, dark muscle, with the water coming out of the wound and the redness around the wound, which won't heal for 3 months. No matter how the surgeon treated him, it didn't work. So this all in there. Then we use 当归连痛汤 and 乳香没药. 乳香没药 can stop the infection into the bloodstream to protect the heart from getting pericarditis. And 当归连痛汤, remember it, is for water retention for edema which caused the pain. Isn't that clear? Okay. Any questions?
Yes, there's a question on what is the Yang Wei pulse?
Come on. You don't mind Yang Wei pulse? Where have you been?
He's new.
Oh, okay. We'll be talking about the 8 extra meridian pulses at the end of seminar, so don't go away. Come on, you don't know my 8 extra meridians?
We can just tell them this one at a time. You don't have time to explain what it is, but you can just tell them it's a 8 extra meridian pulse. 3 of them, they extend from the Tun position.
No problem. We have a graph later.
Okay.
Okay. And this one is a weak type, lack of coordination. And falling, muscle weakness. Actually, you should try this. My pulse has the 8 Bagua pulse. This is superficial, this is middle, this is deep. Sometimes the pulse is like this. I will explain that. There are 8 combinations. I will explain that at the end of this today's class. When you press down hard to the bottom of the pulse, if the rebound is still strong, you can directly tell the patient, hey, you have an inflammation. I wish I had the human body in the model is too big. On the lower leg, anyway. If like this, they can tell, hey, no matter how big, how macho the patient is, hey, your leg is weak. You have no power on the feet or ankle or knee joint or something like that. Then we do things differently. So, okay, let's do it easier for beginners. Let's forget about the 8 extra meridians. You just focus on the deepest area. See, it's weak or strong. See the rebound. If it's strong, that means inflammation. You might want to use my 当归连痛汤 or 生痛足鱼汤. If it's weak, you might use my Kit Young combination to tonify the kidney. Not the real kidney, but the sex kidney. Okay. So in this case, I will use this one. This one is so good. I use it even for the big, strong, macho guys, for the hard workers, for the construction workers, for the big container drivers and everything, even for athletes. I use this one as long as they're weak, despite of their age or something, but mostly very good for ladies with a menopause condition, over 50 years old, and with a weak hot 7 pulse. I will tell you what 7 pulse is. This is my most adaptable. 2仙 and 6 Cs. 6 Cs all for kidney young. In other words, to strengthen your sex hormone. Let's make it easy. Man or woman. 2仙 is also doing the same thing, but it's majorly going down to the left, to the legs, to strengthen up your legs. And the 四逆汤 is for cold, weak people. How do you know the guy's cold or weak or not? You can feel the warmness of the temperature of the hands. You can touch his ankle or her ankle, then you can tell. Even the pulse jumping, but majorly you should focus on the deepest part, is strong or weak. So 6 6 and 2仙 I use a lot in the infertility case, along with the right one. Right good 右归丸 for strengthening the sex hormone and libido. 四逆汤 is just simply like a pusher, put things through the extremities to the small end. So whenever the body, okay, for example, the lady is complaining about the pain in the finger with a carpal tunnel or arthritis or something, I definitely will use 四逆汤, because you can, when you take the pulse, you can just simply touch her or his fingers. If it's cold, then just add it. So push the medicine to that. Like I said, 四逆. Shi Ni Tang, Si means four extremities. Ni means goes back. So when people have a heart failure and heart arrest condition, the temperature will start losing the temperature from the tip or from the toes, gradually extended to the heart. When the coldness reaches the heart, then it's dead. So the Si Ni means backward. So it means the extremities needs the 四逆汤 to push your medicine through the extremities. So I use that a lot for pushing all the good, hard, warm medicine to the extremities. Okay? 这个缺乏协调性很容易摔倒，下肢的肌肉没有力。你可以去摸摸他的腿，如果是冷冷的就不行。左手的尺部很没有力。Left shoe weak and no force. So 重举的时候，浮中层重举的脉很没有力的话呢，大概就是这种状态。OK， 好，还有没有问题 ？Any questions? Sam, I need to know the page. I cannot tell the page number. No, the cover.
I won't tell you number.
No. Oh, okay, still okay, not go. It's okay. Now, next item is that feeling as if you are wearing gloves or socks, but you are not. 感觉好像戴着手套，实际上没有，就是紧紧绷绷的。Numbness 没有感觉那种 all pulses especially left 齿 deep and forceful, still forceful or weak, all the same. But anyway, it's the feeling that's gone. Numbness, and you can touch the patient's hand or the ankle or the legs or something. You can feel that all the skin are so like sandpaper, so rough. In 黄帝内经, in 黄帝内经, I don't know if you have studied it or not. 黄帝内经 that's in the beginning when I was teaching Chinese medicine with the acupuncture 50 years ago, I was using 黄帝内经. It says there's something you have to adjust. The chi is not the pulse. This area is called chi. You have to touch and feel this, the muscle and skin of this area. If it's very smooth, that means something. It's rough, it means something. If it's rough as a sandpaper, that means too much water retention in the human body. It's called adjusted chi. So the 4R. The people with a lot of water retention, okay. So in this case, patient would complain, "Hi, doctor, I feel feeling on the extremities." Okay, let's make it easy. This is a simple combination that works all the time. You don't have to consider about for the inflammation. You just simply use 生痛足鱼汤 and 正骨紫金丹. 正 means straighten up, 骨 means bone. So this is for all the joints, and this is for circulation and for pain, for everything. So put them together, we have all the good circulation around. But if the patient is cold and tired and with a cold feet or something, then you can use my 四逆汤. Okay, it's very easy. Even you don't know how to take the pulse, then you can by just do feeding them and by looking at the ear and the blood temperature and the blood pressure measurement. The blood pressure measurement can directly give you a hint of what medicine to use. Okay, if the blood pressure is high and the temperature is high, I mean the heartbeat rate is high, then obvious it's solid fire. If the blood pressure is high, heartbeat rate is low, not by taking any blockers. So low, that means stagnation. If the blood pressure is low and the heartbeat rate like 67 or something, definitely the patient is weak. You're free to use all the 四逆汤 or even 十全大补. If the patient heartbeat rate is high, like 80, 90, 100, but blood pressure is low, that's called insufficiency. Maybe this patient is suffering from hyperthyroidism or anything. But in this case, no matter what, do not use 四逆汤. You should use something to cool it down, like anti-inflammation agent. We'll be talking about that later. Any questions?
Yeah, Dr. Chang, this formula 正骨紫金丹 is traditionally used for Shaolin temple, like post-trauma broken bone formula, right?
I don't mind it for the joints.
So how do you use this formula?
What do you mean, how do I use it?
Like when would you pick this formula as opposed to another blood moving formula? What are the key points, key symptoms or the key complaints?
Back pain, I mean, joint pain, arthritis.
Joint pain.
Come on.
Okay.
Okay. Oh, yeah. So let's do this. You can see all the redness. So the back pain is obvious. Inflammation, the 生痛足鱼汤 as astringent complex. So the 发炎是很明显的。退火1号 clear hit 1. If it's too much trouble, we talk about that, the formula on the previous classes. But if you do not have it or think too much trouble to premix it in your office, you just simply use astringent complex. You can buy it directly from Tina. And also the 生痛足鱼汤, my favorite. Dry blood stasis from painful body decoration is here. See, you can clearly see that's red. So that's inflammation. This is the stomach bulging out. This is inflammation in the stomach. And this could be the signs for constipation. And see the neck and shoulder is so tight there. See, here we'll also have neck pain. If you want to treat neck pain at the same time, you can add my 金鳞子散 to this one. You know, 金鳞子散 is the 串链子圆弧 to loosen up this one, the tightness of the neck, or you can simply use 葛根汤 to loosen it, or you do some stretchings to loosen up your leg like this exercise to loosen up the tightness of the neck. This one is also very clear. Neck and shoulder. This one, see the redness there? That's inflammation. So we use some same thing. This is the head. And see the neck of this, the neck and shoulder is also inflammation. Actually, this area is the whole lumbar. So easy. And this one is different. This dark spot is supposed to be the constipation point. And this is the hip with little darkness. That means blood stagnation. And this is neck and head. And again, there's a little darkness there for the lady is the breast. Maybe just a calcification point or just a lump. As long as the other ear doesn't have any red spot there, then maybe it's cancer-free. This one looks like a kidney stone there. Anyway, this is the neck and shoulder and the hip pain. Okay, if you really don't know how to take the pulse, but you still can use the ear sign to tell the patient what's wrong with it before asking what seems to be the problem today. Okay, you will gain more confidence from your patient and you'll have good business after this. Okay. If the motor nerves are affected, paralysis may occur. If autonomic nerves are affected, signs like the 运动神经会发生瘫痪。如果自己神经都会发生这些状况的话 autonomic disorder included in here. So you will have this problem. Heat intolerance. Haha, that's easy. 就怕热 the heat cannot tolerate the heat. That's easy. Or the pulse can be very jumpy, expanding, and just by gently touch the skin, then you'll feel the jump is so strong. The rebound is strong. I always use the rebound term. That means when you press down, the rebound is strong, like a big spring. So this is called big pulse. Almost in the first section of my six pulse system, if you ever learned it. So the simple treatment is USA 1. It's the combination of 白虎汤 and 淄博地黄丸 and 龙胆泻肝汤. It covers the whole body. So I always tell the patient, hey, your body is like a volcano. Just everything is so hard. But somebody with different problem, like this one, excess sweating or inability to sweat, Han. Now the patient suffering. Some people, they don't sweat somehow. I don't sweat either. But some, even so hot, there's no sweating. Not like those people with the menopause condition, the hot flushes. If the problem is the sweating, you use 竹叶石膏汤, it works better. Actually, those two are quite similar, but 竹叶石膏汤 is more like the surface condition. In this case, I am using this combination for any kind of skin problem. The skin problem is the surface, right? So a lot of people with big pimples and everything, you don't have to touch the face. You can tell everything's swollen with big pimples there. Then you just simply use this two. Plus, don't ever forget my astringent complex is magical for all kind of inflammation, for the swelling tissues, for the pain, for everything. Okay, you just ask Tina what's in there, huh? I don't remember. 240 how? Okay. Any questions, Tina?
No.
I mean, not from you.
Any questions from anybody? 竹叶石膏汤, I like to use that one for hot flashes.
Yep.
Or in women that don't respond to, you know, the weaker formulas. Like 青蒿鳖甲汤, 知白地黄丸. If those don't work, then I use this one, and it always works because it's really strong.
Especially in the summertime. Huh?
Yes, right now, like right now.
On the other opposite side of the condition, the low blood pressure, 低血压, or something leading to dizziness or something. So you must take the blood pressure in your office before seeing the patient, new or old, doesn't matter. So I always ask your lady to take the patient's blood pressure, even for young kid, not kid, for youngsters, like 20 years old or something, to take the blood pressure, which will give you a good, very clear signs of what herbs to use, or what strategy to use, or what not to use. Even the patient is, the major concern is, doctor, I'm so tired all the time. Actually, 100% of my patients are complaining about being tired, and even the big, strong, macho guys. But if the blood pressure is very high or something, don't ever use anything I'm about to talk about now. The following combination is only for real weak people. How do you know it's weak or not? Taking the pulse? I don't know how to take the pulse. At least you can take the blood pressure. Can you? Come on. So, 低血压, pulse and deep, the blood pressure is low, like the water pressure in a house. So when the beginning, the source, the pressure, the water pressure is low, of course, when you open up the faucet, the water just drip out. They don't rush out. So there's no circulation, definitely. So I use this two stuff. I use it a lot, even in summertime. And 黄芪健中汤. 黄芪is for surface and for energy, especially in summertime. When summertime is so hot, deep, damp and humid, and make people lose energy to work or something. You can also use 清暑益气汤. Tina, you can type it for them.
Okay.
清暑, 清 means clear, 暑 means summertime, 益 means good, 气 means energy. So when you're tired in summertime, I don't have an appetite. All I want to drink is Coke and beer, and make me also more tired. Then it's time to take, for your patient, to take the 清暑益气汤, better digestion and better energy. Huh? Okay. In this case, peripheral nerve damage can affect a single nerve. This is simple, like the bone spur, the neuralgia, or multiple nerves. It depends on the patient's body build. Is strong, is cold, is hard, or weak. We do it differently. 这个周围神经损伤会影响到单条或不同的很多条。你也不要管那么多了。As long as a thin, you can try if. This one is designed for sciatica nerve pain. So the left 齿 will be thin and long as fossil. Left 齿 area, this is thin and long I'll draw it too thick. It's supposed to be thinner. Then you can tell this sciatica problem. And if you're not sure about this pulse, you just look at the ear sign. I will tell you how to differentiate it. It's just simply lumbar problem or disc problem. Okay? It's very easy. It takes only 2 seconds to make up your mind. If it's sciatica problem, then we just simply use my pre-mixed flex spur. This is so good medicine, so good combination. A major ingredients pearl boots are imported from Taiwan, and Sentong Zhuyi Tang and like this old combination. Okay. Good. Oh, Campotano, the same thing, same thing. It just, I usually don't use the term Campotano. I just tell them you have arthritis. Simple. We'll be talking about it later. It doesn't matter what part of the pain, if it's simple, the nervous system and or multiple sclerosis or something like that. I use 四逆汤 like this is the term. This is time for using 四逆汤, like I mentioned earlier, to push the circulation and the medicine to the extremities, to the small ends. Like I said, you can touch the patient's arms, I mean the finger or the fingertip or something, and it's freezing cold, even in such a hot summertime, then you already have something in your head, you know what to use, okay? Oh, so this is my favorite combination. You can also add little 乳香没药 if you want to. It doesn't matter. But this is simple, easy. If you like use acupuncture, okay, it's up to you. But I wouldn't suggest you use needles for those weak, tired, cold people, young ladies. So the Campotano is a term. I don't use the term. It's just some kind of a joint pain. Use it.
So again, if they don't have any coldness in the extremity, then you can take out 四逆汤, right?
Yeah, absolutely. And you can even add little astringent complex to get rid of the inflammation. It works like a magic.
Yeah,
Okay,
I know that formula. That formula is really very effective for all kinds of inflammation.
I have a patient just a few days ago. He complained something. There's a large swollen pain. I wouldn't touch his ass, but the pain is in between the waist and the tailbone. He said, it feels so warm. I don't want to touch it, but I can feel the pulse. It's like this. 齿 is swollen. I give an astringent and the 乳香没药. I even skip all those combinations. Just astringent and the 乳香没药. The pain went away in 2 days. And he called me back, say, hey, doctor, all the swollen tissue touch seems to be softer. It's not so hard. It's softer. And the pain is almost gone in 2 or 3 days. Okay, so that's the magic of my astringent complex. You must have it in your office.
So a little tip for you guys, when I started using the astringent complex, I didn't see the same type of results like Dr. Chang did and the way he described it. And later I showed him my formula and then he told me, oh, no wonder you don't have the effect. It's because I was using too little. I was using like 20% or 15 or 10 in my formula, but he told me you have to at least use 50.
Yes.
Okay, so that's a little tip for you guys if you have never used the formula.
Okay. I think that's a very, very unbelievable invention in Chinese medicine history. The astringent complex. Amazing.
You have many formulas that are unbelievable. I feel like unless, the students have tried it and see it for themselves, it's very hard to understand or appreciate how you put it together, because those herbs in the astringent formula, if you look at them by themselves individually, you would never think they would be that effective.
Yes. Okay, looking. This is the upper arm. So this stagnation is in the upper part. You can ask the patient, you must have some pain in the arm, or it doesn't matter in the wrist or finger or anywhere, just upper arm. And this one's neck and shoulders. See, it's bulging out. You might want to use my sanding. And this one is definitely stagnation. You can use just previous combination for that. And this elderly people is more complicated. This is the sleeping problem. See the big groove? That's a heart problem with the heart murmur, definitely. Short of breath and ischemia and no air in the chest. And see the darkness there? That's the testicle. The testicle area, something there. Maybe this guy had operation on his prostate or something like that. This is the stomach. It looks like so dark. And maybe it's just a scar in the stomach from previous ulcer. And this is the hip area. Huh? And see, okay. Oh no. This area is the sciatica area. If you see a line there, they can tell the sciatica problem. Then you can directly use my bone spur formula. Okay. And see, this is the chest. If you see that in a woman's ear like that, that's something in the breast, 100%. And this is the arthritis too. The darkness there, see? Well, when the people reach certain age, there gotta be a lot of stagnation during his entire life by doing hard work or heavy work or something. This is the pollens in the large intestine. Maybe it's not insignificant. Any questions? Okay. Oh, this is a bad sign, huh? Cancer sign. See the spot? It measures from the outer, the corner of the eye. You draw a line here and this area. Here, and this. Cancer signs, very bad. Not to say this patient had a lot of problem with see the color here, see the color, and the color, all the big problems. And also something here too. Oh, this is the large intestine, maybe the hemorrhoid. This is the sciatica, see? Not very clear, but it's there. So the back pain is there. Oh, see this area is swollen? If you look closer, you'll see all the dots there. That's the swollen of the neck and shoulders. So we might want to use something to destroy that. Like a 16味刘气饮 or 善种会煎汤 or 三灵鹅足. Tina, why don't you type it for them?
Okay, 三灵鹅足吗?
Yeah, 三灵鹅足. This area is the testicle. Oh, see this one? The gallbladder, gallstone or something. And this is the hip. See the redness there? That's inflammation. This is definitely the time to use astringent. And this one, this is the ovary for ladies and the testicles for men. See something there? Swollen in the head or something. Sanling Erzu is so good. Usually we use Sanling Erzu as a bulldozer to push away all the blockage in the human body. But amazingly, it can also treat skin problem along with Ruxiang Moyao. Wow, this is a great tips for you. you'll be very happy to be here because I use 乳香没药三灵而主精两还原酒 tablet form along with 丹参 and 石菖蒲. That's amazing. 丹参 and 石菖蒲 are usually used for open up the chest, to open the circulation for the heart to circulate better. And amazingly, 丹参 and 石菖蒲 along with 三灵而主 and 乳香没药 looks like the combinations for joint pain or something, but it's good for skin problem. Even it works for inflammatory skin problem with all the big red pimples and everywhere. It just worked. Amazing. Because there's a theory behind it. We think all the pain, all the pain, yes, and all the abscess, like we talked about last seminar, abscess and the skin condition, all blame the heart fire. And 丹参石菖蒲三灵而主 can get rid of the heart fire. Heart fire means blood fire, something not so clean in the blood. So by using all that combination, we can clear the heat without having to use any heat clearing combination. That's interesting, isn't it?
Do you use heat clearing formulas first? Because you have the skin combo and other formulas to treat skin.
I have too many combos to
yeah,
think of.
Would you use those formulas first? And if they don't work, then go to the blood moving combination?
There's a logical, there's a gap between symptoms and pauses. Sometimes the symptom, the patient's face is all red, all swollen, but the pause is so damn deep and stagnant that up to you what to choose. Clear the clear the heat in the face or move the blood in the pauses. So sometimes all the darkness there in the face or on the skin or something, but the pause are jumpy and fire. So which one you like to use is up to you. You can choose one or later modify it. We get a lot of conflicts in our daily treatment. It's very difficult to make decisions. Okay, same thing here. This is the hip, and this is neck and shoulder. See, there's a dark spot there. That means an old injury, or somebody even has a lump on the neck and shoulder. You can just simply use the sending. And this is abdominal area, hip. See the hip? See this purple color. Purple color means blood stagnation too. You can use blood moving, definitely. And see the neck and shoulder? See the lumps? The different people, but they have the same condition, the lump. They might have a car accident, injury or something. And you see this, the lump here, see that? Then you can use my 三灵而主乳香没药 生痛足鱼汤 or not. Well, it's okay. And you see this one? Little dark spot there. That's the gallstone or something. Interesting. See, this groove means sleep is not too good. And see the blue purple line here in the stomach area? That means her or his stomach is weak, no power, not running. And this is the arthritis in the upper arm too. Okay, now you know everything. So simple. Okay, now the next part, the second part of our today's seminar, arthritis. There's so many arthritis. You just simply read it. And the same thing here. The hip, the stomach, and the neck and shoulder. See that? And the lump. This is the inner ear. This patient definitely will have vertigo or something like that. And this is the abdomen above his testicle area. Could be something with the prostate related. And this is the stomach. even for put it in a simple way, even you don't take the pause, you still have so many things to tell your patient before asking. Please don't ask. My goal for your learning, your goal for learning from me is don't ask, so you can be a better doctor. Any questions? Okay, see the redness there? That's inflammation. Then definitely, like I said, many months ago, we were talking about arthritis or something. I asked you to buy a temperature gun, the infrared temperature gun. You can buy it from Amazon anywhere. Then you said to measure the painful. That's even easier. You should get one of those in your office. You can measure the. You said to measure. Well, the doctor have the pain in the wrist. Okay, measure the temperature. How much it doesn't matter how much it's. You have to compare it. You compare it to the this one I don't have no pain here, no hurt. Then you measure the temperature. If the painful area is higher than the non-painful area, then it's inflammation. Otherwise, it's blood stagnation. So simple. What's so difficult to be a doctor? You know what I'm saying? If you put temperature, of course you cannot. Oh yes, you can. See all in the picture that all those inflammation are red color. Then you can just simply use your thermal gun to tell the difference between the painful and not so painful joint. Then give you an idea what herbs to use. If it's colder than the normal one, then you use 四逆汤 and other stuff. If it's hotter, warmer than the healthy joint, then you use astringent. Come on, it's so simple. Okay, osteoporosis. Osteoarthritis is the degeneration of the pulse, and so the point is here. So also the yang wei pulse is weak, and actually the heart 7 pulse are weak. Heart 7 pulse is hormone. Well, at least you know the patient's age. Oh, this lady is 55 years old and she is pretty chubby. Then definitely you can tell the hormone is definitely naturally low, and the pulse should be really weak. Then you know the hormone is dead, so no hormone to nourish the joints, so it becomes so degenerated. So I use the combination will be 6 C's. 二仙, 二 means 2. This is a Chinese term. 仙 is a combination of 仙灵皮 and 仙毛. And 右归丸, of course. 右 means right. And 左, how do you spell 左? Means left. 左 means left. Left is cold. Cold herbs. The right gui, the right side is hot, so warm. So put them all together is a warm tonifying combination for sexual hormone or sexual ability, or for warming up the hormone, to strengthen the hormone in order to deal with the degenerate condition. So you have to make up your mind what kind of arthritis the patient is suffering. But most important thing is here. Left yang wei. This pulse is the place I use to tell if there is arthritis or not. I use yang wei pulse. It's not necessarily, sorry, where is it? It's not necessarily weak. If it's strong and jumpy, that's inflammatory. So easy, right? Then you choose my astringent and 镇骨子金丹 and 生痛如鱼汤. Okay. Why I don't use acupuncture? Of course, acupuncture is so good for joint pain, but there are several things that are not so good about using acupuncture. First, I'm too old to do that. I don't have the physical strength. Okay, it's been an hour. You guys tired? You want a break? No, you don't have a break. I'm not tired. You want to change the tape? Okay, I'm sorry. Sam has to change the tape. I'll be back in 5 minutes. Don't go away. Drink a little beer.
Recording stopped.